Soap notes are the most effective way to write progress notes for your patients, enabling you to professionally organize your work in a way that can be understood by healthcare professionals across a variety of disciplines. Not only are they essential for legal compliance, but soap notes are also an excellent medical documentation formatting structure that covers 4 aspects that are integral to the success of patient treatment. There are 4 essential components to a soap note, including subjective, objective, assessment, and plan. This widely adopted structural soap note was theorized by Larry Weed. Today, soap notes are considered the US healthcare standard for capturing clinical information across healthcare professions. Firstly, the S for soap is subjective. This section refers to information regarding the patient's experience and feelings and their perception of symptoms. It is entirely based on their view and often contains verbatim quotes as supporting evidence. The relevant symptoms and complaints should be noted first. Because this is subjective, there should be no personal comments or information that can be deemed as one's own interpretations. It is subjective according to the patient, not you as a practitioner. Here is an example. Susan is feeling down with low self-worth as she outlines, "I feel like I am a failure at work. I work very hard, but I have always been overlooked and my self-confidence plummets. It's affecting how I am at home and I'm beginning to feel miserable." Next is objective. This is concerned with measurable and quantifiable data that can support signs of symptoms. This may include laboratory tests, x-rays, examinations, as well as recordings or vital signs including height, weight, sleeping patterns, blood pressure levels, and any other physiological indications. You may also comment on information such as the patient's body language in the session, as well as their attentiveness and perceived nervousness. Be careful that this does not translate as an assumption, as it still needs to be objective in that any healthcare professional would also agree with your professional opinion. Here is an example. Susan has a flat expression and is slumped in her chair. She presents low symptoms and indicates feeling of low self-esteem that are beginning to impair her day-to-day functioning. A is for assessment. The assessment section is the evaluation of the patient and their symptoms and is a synthesis of both the subjective and objective information presented. It is based on clinical criteria which may reference to established models. Commentary is encouraged on the progress of the patient in comparison to previous sessions, and whether they demonstrate any improvements towards their objectives or goals. It serves as a logical progression point from which the plan is formed, and it illustrates clear medical reasoning behind the planned treatment. Here is an example. This is Susan's second session, and she is working on ways to communicate her feelings to her work, while realizing her self-worth. Failure to do so will likely result in increased depressive feelings for Susan. She does not seem to have markedly improved since our previous sessions, so we will be developing upon her current coping strategies. Lastly is P for plan. The plan involves a future course of action concerning the patient's treatment and builds upon what was outlined in the assessment section. There should be specific, clear, and achievable goals for the patient to work on between sessions, and the practitioner needs to work with the patient to ensure that these goals are plausible. Here is an example. Susan will attend further sessions, and we have conducted a plan to work on her perception of self and way to problem solve at work. If symptoms do not improve within the next 2 weeks, we will discuss additional treatment and re-evaluation. This includes group therapy or further behavioral techniques decided by consultation and other healthcare providers. Soap notes are broadly utilized and perceived in the medical care industry. They are an excellent strategy that aids clear organization and are simple to decipher by other medical service experts because of their professional methodology. At Carepatron, we provide a soap notes template which you can use for free. It's available in the link in our description. If you found this video helpful, give us a like or subscribe to our channel for more resources like these.